Us. Just minutes ago, I talked to Republican Congressman Paul Ryan of Wisconsin. Congressman Ryan, thank you so much for being with us this morning.
Morning, Diane.
Let me start with you as I did with the president yesterday. Same question. Will there be a health care reform bill by the end of the year? Does there have to be?
Well, I think there should be. We believe we should fix our problems in our health care system, and that we do have problems that need to be fixed. I think there probably will be health care reform. Unfortunately, it doesn't look like it's going to be a bipartisan health care reform of the kind that we've been proposing, because the Democrats, quite literally, they have the votes, and they've told us that they're really not interested in sincere bipartisanship. So I think they're going to be pushing their version of reform through, and they probably will get it done by the end of the year. And they're insisting on this public plan option, which we think is a non-starter. And I know we'll get into this, but basically we think the public plan option becomes a government-run monopoly, and that's not just something we believe. It's what all the experts are telling us happens.
But let me ask you this. Their principal explanation of the public plan option is that it will be there to help, I guess, as a kind of accelerator or brake control on the costs of the spiraling industry. It will be there to make sure that, hey, if you want to go with the private plans, great, but if they come up with a more efficient plan, you've got that option. What alternative is there to make sure that efficiency is in the private care system as well?
Well, you can have universal access to affordable health insurance for every American, regardless of pre-existing condition in America, without the government taking it over, with a private-based system. That's exactly what I and others, like Congressman Devin Nunes and Senators Tom Coburn and Richard Burr, have proposed. We have a bill called the Patient's Choice Act, which achieves those things without having the government take it over. Here's the problem with the public plan option. The public plan option is a stacked deck. It's basically the government being the referee and the player in the same game.
I want to turn to the other big issue, the big engine driving the escalating cost, which is this vicious circle that patients and doctors are in on the number of tests, number of procedures. By some analyses, maybe 30% of them are unnecessary treatments because doctors are afraid of malpractice and patients have come to expect them. How would you stop that?
Well, we proposed tort reform. That's one of the things that the president has kind of taken off of the table, and the Democrats have well. Defensive medicine is medicine that is practiced by physicians in hospitals trying to avoid lawsuits.
Do you think the president eventually will have to accept some kind of taxation of benefits?
I don't know. We believe that we ought to end the discrimination against people who don't get health insurance through their employers in the tax code. And so what I've proposed is equalize the tax treatment. Give everybody the same benefit regardless of how they get their job, and take that tax benefit and delink it from the job and reattach it to the worker, so that worker keeps that benefit regardless of whether they go unemployed or change jobs and end jobs lock.
Thank you so much, Congressman Ryan.
Thank you, Diane.